Welcome to the Tom Matt Show. You are walking through the front door of the refirement zone. And now, your host, Tom Matt.
Welcome, everyone. Welcome. Thank you to Sandy for that intro. Love hearing her voice on the broadcast side of things. For those of you in video land, how are you? How's everything going? Good to see all of you and bring you our episode this week, Performance Living, Augmented Reality and Technology with Dr. Anthony Avellino. Guy's so awesome. I can't even speak. I get him around. It's just, I can't say enough about the guy. But before we go there, last week, another outstanding, I don't know, the show's just getting better and better. And I'm not just saying that because I'm just doing my thing, but we had Brock Fletcher and Kendall Brooks. Kendall Brooks is a safety for the Tennessee Titans. Played at Michigan State University. His story is so overwhelmingly great. You should check that out. I would absolutely do that. Investing in real estate, aspiring for greatness. So we talked about how when he interned with Brock Fletcher at the selling team of Keller Williams, how it really helped him figure out what he wanted to do because his dream was always to be in the NFL. And guess what? He just signed a 2-year contract with the Tennessee Titans, and the guy's a millionaire. So, hey, Jed's a millionaire. There you go. We got it. Kendall Brooks, Brock Fletcher. Check that one out. Dr. Anthony Avellino's back. Performance Living's going great. These episodes are getting more and more popular, get more and more outreach out there. The tech people love it. We're going to talk augmented reality and technology. At first, I was almost over my head a little bit, everybody. So if it's a little bit over my head, it's like, okay, I got to do a little digging here. Then I did some digging. I'm like, oh, okay, I see what we're doing here because Dr. Avellino sends us good info. Dr. Anthony Avellino, former NCAA student athlete at good old Cornell University, active endurance ultra runner. We've had shows about that one. The big why behind that, to go check that one out. That was hilarious. We talk about his ultra running every now and then, just his decompression. Tony, it comes up every now and then. October 2019, this is the two craziest things ever. October 2019, January 2021. See how I skipped over all the medical stuff? I just went to all of his like social things. Who cares that he's got all these degrees and all this stuff? He was fortunate to be a deckhand on the FV Saga, a commercial crab fishing boat profiled in Discovery Channel's Deadliest Catch. Yeah, then we did another conference on that one with Jake Anderson. That was hilarious. Further, his book, Finding Purpose, A Neurosurgeon's Journey of Hope and Healing. That's a wonderful book. Tony and I did a speaking engagement talking to some students at Michigan State years ago on that. We're going to talk some augmented reality and tech, but mostly tech because Tony is tech man. I want to welcome back to the program, Performance Living, the talent behind the mic, Dr. Anthony Avellino. Hey, Tony, how are you?
Tom, it's great to be here, and it's great to see your face.
Yeah, well, good to hear your voice too, man. For the radio people out there, they're all like, I can't see his face on my radio. But that's technology, man, right? That's where we are with all this tech stuff. It's like, you know what? 2 years ago, I never thought I always just wanted to do radio. I just wanted to do radio and podcast. And then the video stuff came along, Tony, and Jed's a millionaire, as we said about Kendall Brooks. I mean, how's your family doing? How's everything going over there? How's Michael start at Meta yet?
No, he is finishing his last year. And so he is graduating from the engineering school in May. And then he begins his job at Meta in the Pacific Northwest, Seattle in June. And it's must say that it's a little surreal for us because we actually lived there for a long, long time. And in fact, Michael was born there. Remarkable because out of both of my kids, we never thought that Michael would be back there. But yeah, so he is going to transition there in June, and it gives Jen and I really a chance to see our old friends too. Because I must say that Seattle and the Pacific Northwest, from like June through September, it is a beautiful place to live. It's mild weather. You have the mountains, you have the sunshine, but yeah, so things are doing okay.
Happy for the family on that side with Michael and doing his thing at Meta. Tony didn't brag at all, everybody, but I will, because I know Michael. Michael's been on the program. He's graduating in 3 years from Cornell, which is a outstanding school where his dad went to school, and they got to tour the dorms where his dad lived back in the day. We talked about that on a previous show. All right, enough about Michael.
Yeah.
Talk about Jen and Ashley, and then we'll get rolling here. We got to talk about the family, everybody. If you're new to the program, we always do This Is Your Life. So welcome to the program. If you're new to the program, if you're just a regular fan, which I'm glad that you're here, and thank you so much for listening, watching, whatever you're doing. You know how we do this stuff. It's always This Is Your Life is the first segment. So what about Jen? What about Ashley?
Yeah. So my actually wife is doing great. Yeah. Her horse really keeps her very, very busy. And as you know, my daughter is finishing up her first year of law school at ASU. And she really likes the legal aspects of things. So, but most importantly, I must say that Jen and I are really blessed, is because at the end of the day is your family is what matters most. And what I realized over the last 5 years or so is getting people to talk about the families is a great way to begin a conversation. It's a great way to begin a story because family is what binds us. Family is what connects us. And family is what matters to us.
But, it just makes you real, Tony. That's why we open the show like this every episode. I mean, 14 years of this thing, we've done thousands of these things. And we've always opened it that way. Always felt like it's like, well, let's get to know the people. Who's the person behind there? Who's Dr. Avellino? Makes you real. You're a parent. You've gone through the ups and downs. Heck, you were just talking about how we're setting up some more segments, everybody, some more episodes, phases of life, and perhaps, how your 50s are things that you never anticipate. Tony, talk about that for just a second. We got 2 minutes to go before we go to break here. Talk about how the 50s, in your perception and perspective, are way different than whatever you thought it was going to be. And now that you're through that transitional phase, the last 5 years you were just talking about, talk about that for a second.
I often say, not to be cliche, but you learn most about yourselves through getting out of your comfort zone, expanding your limits. Because for me, is I never thought in my mid 50s, I would be in a place where I would be actively looking for another role. And as you and I spoke about this prior, is the COVID pandemic has really made a lot of us pause, and it made me pause. But I think as we transition out of the COVID pandemic, I think people are transitioning more. And as people age, as people live longer, I think people in their 50s and 60s are going to transition into new roles, new actually jobs. And every time you transition, it brings in a little bit of anxiety. And so, walking through that would actually be a big help.
That's why we call it the refirement zone, everybody. I mean, it's simple. You're going to go through these phases like Dr. Avellino was talking about. Okay, let me reset this thing. We're going to go to break here. Performance living. This one's about augmented reality, why it's important, why it's going to increase patient safety, and hopefully help the physician's workflow. We're going to talk about all kinds of things. Tony's got some good things to share with us for his 14th visit. Once again, Performance Living, Augmented Reality and Technology with Dr. Anthony Avellino. This is The Tom Matt Show.
This segment of The Tom Matt Show is brought to you in part by The Source of Light and Power by band leader Archival and broadcaster Mitch Anderson. Hear the sound that is endorsed by Odyssey headphones, linear tube audio, RME converters, and Peluso microphones at sourceoflightandpower.bandcamp.com.
Welcome to the Tom Matt Show.
Welcome back, everybody. Thank you, Sandy, for bringing us in. Dr. Anthony Avellino is with us, Performance Living, Augmented Reality, and Technology. Our second segment of our radio program, podcast, video stream, is sponsored by Craig Stiles, Ameriprise Financial. Full disclosure, we're just talking about retirement when we just closed the previous segment. Retirement savings, important. It enables you to do your retirement zone work. That's the deal. That's why you want to go to Ameriprise Financial like we did with Craig. Got all of our retirement zone savings, all of it. And I don't worry about diddly crap, except, can we make more money? Because I want to put more money into this gig over here, and I want to do this thing over here. Can I get some more? Can I do more? Can we help our money make money? Craig Stiles is the guy. He is the creator of Decideri Analytics, where we are making light of weighted decisions. That's why you want to go to Craig. Call 1-800-528-1355. 517-483-4893 is another number you can call. You can email craig.stiles@ampf.com. His offices are located 2651 Coolidge Road, Suite 103, East Lansing, Michigan, 48823. Stations that have carried us in the past. Of course, the Michigan Talk Network blasts us all over the Midwest. But here are stations that have carried us. Broadcast radio is pretty crazy. WGIM 1240 AM is the flagship of the Michigan Talk Network. Thank you to Steve and Ivy Gruber for keeping us on the airwaves and all the staff that helps put us going on the Michigan Talk Network. We're very, very grateful to everyone over there. WGHN 92.1 in Grand Haven carried us for a long, long time. First on broadcast radio ever. WJRW 1340 in Grand Rapids. WKOQ 1490 in Muskegon. WYPV FM 94.5 in Mackinac City. And, of course, our PBS affiliate at Michigan State University, AM 870 and simulcast at 102.3 FM, East Lansing, Michigan, 5 o'clock Sundays. There's where you can get them. You can get the stream there as well. And I want to plug all of our books. We have 4 books on Amazon. Please go check those out. You will like them. They are good. Generation Us is happening. That's the latest. But Maximize Your Quality of Life still has a lot of really, really good tips in it about everything from, you name it, brain health to nutrition to pooping well to doing all kinds of good stuff. Dr. Avellino's here. That means it's Performance Living Day. Augmented reality and technology. I love doing these tech shows, Tony. I love doing these tech shows. I started, when I saw the notes for the show, as I was I was telling Tony before during our pre-production, I learned so much when I talk to Tony. He sends me these notes and I have to decipher what they are. Then I look them up and I'm like, oh, this is going to be great radio. This is going to be great radio. It's just, you have to, this is what, understanding why this can make our healthcare way, way better. Let's start right at the top there, Tony. Neurosurgical advances such as AR and VR, mixed reality. Why, on all of these topics, why do patients need to know the bang for their buck? What do they need to know about this? And why is it important for people to understand? Go ahead.
Tom, healthcare is changing so fast. As you and I have discussed in the past, in 1950, medical knowledge doubled every 50 years. Last year, medical knowledge doubled every 73 days. Every 73 days. In 2024, there were over 1.5 million peer-reviewed biomedical journal articles. And so the reason why I say that is because medicine is advancing so quickly. Artificial intelligence is going to change the way we educate medical students. It's going to change the way how we diagnose and treat. But just giving some people some perspective is how neurosurgery has really changed. When I trained in neurosurgery in the 1990s, it's very different today, 2024. And a lot of it really comes down to is the medical knowledge, medical technology is advancing so quickly. And in the surgical field, anytime you can prevent complications and enhance quality and patient outcomes, that's the most important. So anytime that from a surgical perspective or a medical perspective, you can make a treatment or a drug safer. But from a surgical side of things, anytime you can decrease the blood loss, decrease the operative time, decrease the amount of patients stay in the hospital, and making things safer, and so it'd be great to give your listeners some perspective how neurosciences or neurosurgery has really evolved. I often say that what cardiovascular disease was the last 30 years is what neurosciences will be. And I think artificial intelligence, augmented virtual reality, robotics is really going to change things the way from a patient engagement standpoint, or how to teach a surgeon how to do a procedure in less time that's safer.
So, Tony, do we start talking about the teaching aspect, or do we talk about the patient aspect? Because you have both sides of it. Mm-hmm. And I liked what you said about the quality and patient outcome. But one of the just quick takeaways I had from what you just said was the surgical side of thing. And I wrote down decreases everything. And I mean that by like cost and time in the hospital. If you can have an improved workflow for the hospital staff and the physicians, if you can have safety for the patient, isn't that a huge benefit? Can't we have better results and get the costs down?
Yeah. So if we go through the patient engagement first, and then really, and then focusing on how AR or VR technology can make the surgeon or the physician perform the procedure safer.
Got it.
Because as you and I have discussed before, I have this formula as performance equals skill minus interference. So if you're an elite scholar, elite athlete, and I think athletes and surgeons, really it's sort of the same type of training, because in both aspects, you have to train your body, you have to train your craft, and you have to train your mind.
So the patient engagement. Okay, so let me set this up here, everybody, because we're coming up on break here. I'm going to reset this thing. This is a performance living episode, augmented reality, medicine, neurosurgery. Because we have Dr. Avellino with us, who is a pediatric neurosurgeon, we're going to talk about patient engagement leading into the AR, VR technology and why that's important, weaving in the teaching. And through all of that, Tony will talk about decreased blood loss, decreased operative time. I like the decrease of all of these things he's talking about because I think it saves us money, gets you back to work, gets you back to doing what you want to do. And if you're not laid up on the couch from a trainer's perspective, I want you up and about as soon as possible, and I'm sure the docs do as well. Again, Dr. Avellino's here, performance living, augmented reality and technology. We're going to talk patient engagement. We come back. This is the Tom Mann Show.
Thank you again to our Segment 2 sponsor, Craig Stiles of Ameriprise Financial. For more information on services provided by Craig, please visit ameripriseadvisors.com/Craig.Stiles or by calling 517-483-4893. You're tuned in to The Tom Mann Show.
Welcome to the Tom Mann Show.
Thank you, Sandy, for bringing us back. Thank you, everyone, for joining us. Tom Mann Show this week, Performance Living with Dr. Anthony Avellino. Augmented reality and technology. We've been setting this thing up, talking about neurosurgical advances in AR and VR, mixed reality, why it's important, what it's going to do for you. Why is this good radio? It's informative. And here's the thing, everybody. It's educational and it's informative. Okay? Want to remind everybody that this segment is sponsored by Brock Fletcher, selling team of Keller Williams. Brock, love Brock so much. 517-853-6408. 517-303-3262. The cell phone number. Just last week's show had him here with Kendall Brooks and Brock Fletcher. It was awesome. Go online at kwsellingteam.com. Kendall Brooks was one of Brock's first interns he ever had from Michigan State University. Now the guy's in the NFL. True story. That's what I'm saying about Brock. Brock's such a good guy. And again, what up, Mike? Mikey Deadman, our buyer's agent for Little House Lansing, where we're recording this episode today. Great spot. Love this place. Got our neighbor next door. Won't mention his name, Jason Damon. Just knew him when he was 2 years old. Wonderful. Just awesome. Thank you to the selling team of Keller Williams Realty. Again, 517-303-3262. Brock's number. Go there online, kwsellingteam.com. Go to our website, tommattshow.com. Bottom of the homepage. Boom. Click on those links. Take you right to their websites. Boom. That's where you go. Most agents spend an average of $400 or $500 a month on marketing. Brock spends thousands. Marketing dollars every month. Creates demand. Sells homes fast and for top dollar. Plus, he's informative and he's honest. And we trust him. And he helped us a lot. So please help our sponsors, because without our sponsors, everybody, we can't do this thing. And that would be a shame. Craig, great guy, Ameriprise Financial, got a big wedding coming up, got to support him. And then Brock Fletcher, got a daughter going through college, almost done with graduate school. We're all just doing the thing. Just like our guest today, Dr. Anthony Avellino. His 2 children are finishing college, doing great. Talked about them earlier in the episode. Been talking about reality and technology, augmented reality and technology in medical history and neurosurgery, and how the history has changed so quickly. Dr. Avellino is telling us about, everything. You're doubling the knowledge every 70 days. It's just insane.
73 days.
73 days. All right.
Medical knowledge, 73 days. Massive amount of information.
Crazy. I mean, how do you manage it? Okay, let's talk about how, if we manage it well, the patient engagement should be what, Tony? And you specifically wanted to talk about this,
Sure.
So I know this is important. Go right ahead, please.
Yeah. I look at patient engagement in 2 ways. One is from an educational standpoint of how we can use augmented and virtual or mixed reality to explain a specific procedure to a patient that they're going to undergo. So from an education standpoint, but then secondly is how you can enhance the patient experience. Because again, healthcare is changing so quickly. Patients have choices. Patients want to have the best outcomes and the best experience. And so if we take the educational experience first, like, for example, in my field is if I have a patient that has a brain tumor in a specific region of the brain, I can show the family or the patient the films, but it's really in sort of a 2-dimensional and not a 3D. And oftentimes you can explain it, but it's not that easy to understand. For example, if you had a brain tumor in an eloquent area of the brain, such as around areas of the brain that control your speech or moving your arm or leg, we're in AR and VR inputting the MR or CT or brain imaging study in a AR virtual reality. You can literally have the patient put the goggles on, and you can sort of explain to the patient, okay, well, you can walk them through the operation before the operation occurs. Meaning that you can say, okay, well, it's here. We're going to make an incision in your skin. We're going to make a hole in your skull. But then from a risk standpoint, because oftentimes it's not that easy to visualize things or explain things if you just have films. Like, for example, you can put the goggles on and you can fly through, you can fly into the brain, and you can say, okay, well, if I go a little bit to the right of the lesion, that can affect your speech area. If I go a little bit to the left of the region, that can control your ability to move your arm and leg. And what we can do with these brain images is put in tracks, meaning with if you can imagine different colors in the brain. And so it allows you to enhance the education and really explain the benefits and risk of a specific procedure, because anytime you can enhance the learning is key.
I got to ask you, man. I mean, I love this explanation you're giving here with the education. This has got to be such a stress relief to your patients when you're explaining and you let them visualize what you're talking about, because it's got to be so hard to explain if you're showing them is it a 1D image with film, like a flat film, a digital image,
flat film, right?
Or a digital image, and then you put them into a 3D sort of thing. That's got to make things. That's got to really help them, because I know how much if you get the patient's head right, Tony, if you get them thinking in the right way, your outcome's going to be better. Correct?
Yeah, my philosophy has always been education, explaining the risks and benefits. Because what we want to do is we want to give the patient all the options and explain to them all the risks and benefits, because that's where you have informed consent. And having informed consent and really having the patient truly understand the procedure, but also it goes both ways. It allows the surgeon to also understand the operation better. And we can go to that next.
Okay, we'll talk about that because we got about a minute and a half to go. So continue to set this up, Tony, because you've got the AR and the VR. I'll give you the signal here. You got the AR and the VR technology that you want to talk about. I love the education and the enhancing the patient experience thing. I just think that, well, it's not only making you as a physician a better physician, it's making a patient a more informed consumer. And is it lowering the cost? Does it help with the cost? Or how does this, I don't know. Tell me.
I think from enhancing and from educating, it really, I'm not sure if it lowers the cost. Well, it lowers the cost in that if a complication occurs, sometimes the legal system and you get sued. And you and I've spoke about this in my lifetime. I've been doing this for 20 plus years. And every year I have an honest mistake or the disease is so devastating that I cannot help someone. So the things that keep me up at night are not the hundreds or thousands of patients that I treat that have a great outcome. It's the one or two every year that I make an honest mistake or the disease is so devastating I can't do nothing about it. I've been in practice for 20 years. So I have 40 patients out there that it's my fault.
This is a very sensitive subject for my physician friend. That's why Tony wrote his book, because he needed to share with people his true feelings of the burnout and the imbalance in life. And so these types of tools and understanding, be able to communicate with your physicians when you go into the doctor's office, everybody, is going to make your performance in your life much better. That's why we do performance living. That's why we do this topic with Dr. Avellino, Dr. Anthony Avellino, augmented reality and technology. We're coming back. We've got more. This is the Tom Matt Show.
Thank you again to Brock Fletcher, real estate agent at the selling team with Keller Williams Realty. For more information on services provided by Brock, please call his personal cell phone at 517-303-3262 or by emailing Brock at kwsellingteam.com. This is the Tom Matt Show.
Welcome to the Tom Matt Show.
Welcome back, everybody. Welcome back to this week's episode of the Tom Matt Show. Performance Living with Dr. Anthony Avellino. Augmented reality, medicine, neurosurgery, all these good things. You know, when we have Dr. Avellino here, he's a pediatric neurosurgeon, 20 years in the operating room, kind of knows what he's talking about here, and he's still learning. He's still learning. He's still taking out the trash, though, because you know what? When Jen says take out the trash, he's taking out the trash. So we know how Jen knows how to get a hold of you there, Dr. Avellino. How would you like other people to get a hold of you?
There are two ways. One, you can go to my website, findingpurposeavellino.com, or you can email me at findingpurpose37@gmail.com.
Simple. We'll have it all in the recap, as always. And there are 13 other episodes that you can go check out with Dr. Avellino. a lot of the performance living, and we do a lot of this technical stuff because the medicine and performance living is really derived from all of these supremely important medical advances, science, all of these good things. It's crazy what's going on out there. AR, VR tech, brother. Let's talk about it. Let's continue this whole conversation, neurosurgical advances in this field. What did you want to share with the listeners? Why is it important for them to understand what this is all about?
So besides using augmented or virtual or mixed reality for education patients, either education patients or education the surgeon, is I think the experience is really important, because in healthcare, having satisfied patients is absolutely extremely important. So I would not be surprised in the near future that AR and VR, as the technology, as the goggles get smaller, and people get more facile, and as the younger generation really likes this, using it as a patient experience. Because if you can envision, you have an appointment with your physician in the clinic. Prior to the appointment, your physician sends you a web link. You put on the goggles. The goggles will show you how to get from your home to the office. So you're driving. It shows you where to park. It shows you where to walk into the various places to see him or her. And oftentimes, how many times do you go to a physician's office and get lost?
All the time.
Right? You don't know where you are, right? So that's one. But also from a surgical perspective, just imagine, you see your surgeon, you actually book your operation. It could be a knee surgery, it could be an orthopedic surgery, it could be an ENT, it could be it could be any type of surgery. But just imagine the physician sends you a link, you put on the goggles with the link. Again, you're in your home. It shows you how to get to the hospital. Then it shows you where to walk, what elevators to take. And then it shows you, and then it can also show you what the preoperative area looks like, what the postoperative area looks like, what a room looks like. Because I think what we need to, it comes down to that education, because knowing and decreasing the amount of uncertainty brings down the anxiety level. And as you and I discussed, anytime you can bring down the stress levels, anxiety, whatever it is, it could be music therapy, exercise, prayer, gardening, meditation, herbs, whatever you use, anything that decreases that anxiety is going to have, because people have shown, as you and I discussed, that the chronic inflammation, when you have anxiety, you have all these steroids released, you have this chronic inflammation in your body, which doesn't promote healing, but it delays healing, because there's been studies shown that that an incision in your skin will take longer to heal if you have a lot of stress.
Wow. See, that's the thing about there's studies out there, everybody. You could have back pain. It could be a phantom pain. It could be caused from a neurological issue. And it could be, who knows? It might not even be a spine issue. I mean, Tony, in your notes, you also were talking about cranial and spine surgery. You're talking about how my daughter, Ashley, just had spine surgery. I mean, it seems like it's becoming more and more common.
Yeah. I mean, this AR and VR technology and all these image guidance systems that we use, like for example, when I trained in the 90s, in order to take out a brain tumor, you used to measure with an index card on a film to measure how many centimeters above the ear it is or behind the eye to show you where you go. Now, for the last 15, 20 years, we have image guidance systems in the operating room, and it's like a GPS system. So prior to the operation, you input all these computer markings into a computer system, and then using a pencil, you can pinpoint exactly where you are. And if you know exactly where you are, you can make the incision small, you can make the hole in the skull smaller. And anytime things are smaller, you have less anesthesia, less operative time, less blood loss, better outcomes, and happy and satisfied patients.
Decreasing everything. I've got notes here. Improved accuracy from what Dr. Avellino was just saying. Image-guided technology allows surgeons to precisely place spinal implants and navigate complex spinal anatomy. They get to see what they're doing ahead of time. Reduced, something you didn't mention, Tony, was reduced radiation exposure. That's in the notes here.
Absolutely right. Yeah, absolutely right.
What happens with that? Why would you have a radiation exposure to? Is it the X-rays, or is it what is it? What causes that? Where is that coming from?
Yeah. So oftentimes, if we're doing a spine operation, putting screws in or for various things, is we use intraoperative fluoroscopy or intraoperative X-ray. And the more you don't know, using robotics or using these image-guided systems, you can put the screws in exactly where they should be. In the old days, we didn't have these systems. And so using freehand, trying to put these screws in, especially if you have these very deformed spines, it makes it, the complication rate goes up, but it's really tough.
The notes I'm also seeing here, Tony, minimally invasive, improved visualization, and here's a big one, reduced pain. Reduced pain from all of these things that you guys are implementing now with AR and VR. Improved function. I can tell you right now that Ashley's back surgery, I had to cool her jets down because, of course, she's just like her dad, who, I'm feeling better, let's go run a marathon or go pound some weights or something. And of course, she dinged herself a little bit. You start feeling better so much quicker. You got to be cool with your rehab. So it's just like, and you got shorter operating time. So again, another decrease. It sounds like a win-win all the way around, Tony. All the way around sounds like a win-win. Is there anything bad about it? Is it the training? Is it the cost? What are some of the downsides?
Yeah. So I would say that as technology improves, the optics, the accuracy are all getting better. But I think the training aspect, what you hit on, is really important, because before you do these procedures, you have to be adequately trained. And robotic surgery for various things in the prostate surgery world, in the gynecology world, it takes practice. And now, since a lot of surgeons are using robotics during residency training, you're very versed in that. When I trained, we didn't have it at all. But I mean, that's the exciting thing about medicine. It's sort of an evolution. It's a transformation. You have to transform with yourself with the times.
I want to ask you some questions here, but we're going to run out of time here. But so I'll set this up. And here's my question, and I don't expect an answer right here, Tony, because again, like I said, we're going to come up on break. But robotic surgery skills, when you're talking about this, okay, you've got the younger doctors coming in. We'll come back. We'll answer this question in the next segment. You've got the younger doctors; they're getting trained in these new skills now. The older doctors are. Is it like all kinds of technology where you need to practice, you need to continue to use the machine, the software, the robot to continue to improve your skills? Is that important? Is it like a computer? Is it something like that? Like if you take a month off, do your skills decline? You know what I'm saying? Is there something that's happening for all of you physicians to keep your skills at the very top of the level? And that's the question I'm trying to frame up, and I'll ask you for the answer when we come back. Again, let me reset. Performance living, augmented reality and technology, Dr. Anthony Avellino. See, we get into some deep stuff here, everybody. We're talking education, entertainment, removing fear. This is the Tom Matt Show.
For more information on the Tom Matt RFZ mentality, please visit our brand new website at www.tommattshow.com. Subscribe to our podcast via your favorite podcast platform. Visit our brand new YouTube channel for consistently motivating messaging. This is the Tom Matt Show.
Welcome to the Tom Matt Show.
Hey, everybody. Welcome back. Thank you so much for listening, watching, downloading, subscribing. Appreciate all of you so very much for doing all of that. Our YouTube is doing fantastic, and I hope that all of you subscribe to it, and we're going to bring you the best that we can. And for all of the people out there that are sending me all those very, very nice comments about our guests and our topics and Vanessa's video editing and everything that we're trying so hard to bring you the best content that we can. And we've been doing this a long time. This is our 14th season doing this stuff, and we are continually getting better. And I swear to you, I have said, I want to be a 15-year overnight success story. So I got another year, another season to go before we hit like giant big time. And it's through guests like Anthony Avellino, Dr. Anthony Avellino, that we're going to continue to do this thing with our performance living, talking about augmented reality and technology. My question, we're talking a lot about tech. We do a lot of tech talk with Dr. Avellino because medicine is going that way. But the robotic skills, as Dr. Avellino was explaining in the previous segment, everybody, he was talking about the younger doctors and older doctors, and all of these newfangled gizmos and gadgets. Okay, you got all the gizmos and gadgets. Now, how many people out there now work on their own cars? Where back in the day, I was never a mechanic, but my brother was, and he would go tear into a car and he'd change the timing and do it. Nowadays, ain't happening. My question for Dr. Avellino, thinking like an athlete, like I'm a trainer and an athlete, I'm thinking, okay, you're in the major leagues. He's a major leaguer. He made a reference to being like a professional athlete. A surgeon is like a professional athlete. So we're gonna think the same way. So Dr. Avellino, you don't go in for batting practice, and now you're facing Nolan Ryan, and you don't do batting practice for a week. Are your skills going to suffer? Is that a good analogy for the skills that are taken for robotic surgery? Is that a good way of looking at it?
Yeah. So many people say in order to become an expert, you have to have those 10,000 hours. If you're starting robotic surgery or using some new technology in the operating room, having the ability to practice before the operation is key. And just getting back to AR and VR, because if you're an athlete or you're a musician, before you play sport or before you participate in a musical event, you practice, right? If you're a musician, you have warm-up skills, people are practicing, getting warmed up. If you're a baseball player, you're throwing the ball. If you're a football player, you're throwing the ball. But in surgery, we don't have that. But what AR and VR does, and I think the technology will advance, because right now you don't have any haptic feedback. And what I mean by haptic feedback is feeling and touching the pressure. But I don't think we're too far in the future. That I always had the concept is, what is a surgical warm-up? How to train your craft, right? You want to train your mind, body. And there must be a one, but what AR can do is a few things. One is, prior to the operation, the day before, you can put on the goggles and you can see in a 3D where the tumor is or where the vascular malformation is. You can rotate the vessels around the brain. You can rotate the brain, so you actually know before going into where the critical structures are. And I think one is training your mind. I think just knowing, because in the 1990s, we had 2-dimensional films. We couldn't do 3D rotations. If we had a brain aneurysm, which is an outpouching or balloon of a blood vessel, and if it burst, that can cause an intracerebral hemorrhage or bleeding within the brain. And it would be nice if we knew where the critical structures were around the blood vessels. And now what AR and VR could do is you can train your mind. You can know, okay, if I'm going to get in there, I know that there's a vessel in the back of the aneurysm that I need to.
Tony, excuse me, but it almost sounds like you're doing pregame film study.
Exactly. That's exactly what it is, Tom. But also, think the most important question you asked is how many times did we go in the operating room? You wake up at 5 a.m., 6 a.m., go in the hospital. You're cold, your hands are cold, you're rushing in, you're not warmed up. And it'd be nice to if we could develop a paradigm using AR and VR. What's a routine warm up? Spend like 2 or 3 minutes on a console. Like if you're going to do a robotic surgery, is there a way that prior to doing the procedure, you spend 2 or 3 minutes warming up your hands or fooling with the dials or something? I mean, that would be very powerful.
Does this happen now for you, for your staff, and for you?
Tom, I think about it, but it doesn't routinely. No.
Why?
That's why we do these radio shows.
That's why we do these radio shows.
Exactly.
Asking the whys.
It's the why, but I truly think that we're going to get to a phase that there's going to be some type of pre-game warm-up, to warm up your mind with that pre-game film review,
sure,
but also to warm up your hands.
Well, and then warm up your emotions, warm up your brain,
exactly.
Get everything. It's almost like getting a real quick dump before a final exam. You know how you get that exam anxiety. Everybody remember back when you're in high school or in college, and you got that final exam thing, or you're going for your master's degree. I remember when I had to take my comprehensive exam for my master's, an all-day exam. There was some stress there. You could take the virtual reality and you could go in there and get your brain warmed up about 5 or 10 minutes and just kind of go in there and lower your stress level and get your confidence up and say, okay, just chill down. Seems to me like that's a no-brainer. It's like, we got to make this happen. Okay, we're making a stand right here on radio, everybody. Performance Living, this date that we recorded this thing with Dr. Anthony Avellino, we got to get this going for our doctors, because you know what? When you go in for your consult, as Dr. Avellino was talking about, the education and enhancing the patient experience, ask them about it. Say, I heard Dr. Avellino say you need to take 3 or 4. Are you taking 3 or 4 or 5 minutes? What do you think about that, Tony?
Warming up. Yeah, it's true. But Tom, that's how we can all get better.
That's how we get better.
And that's the powerful thing about your radio show. And I want to congratulate you for 2 million views, because I know how hard you worked. And, you got to keep on refining the refinement zone. You got to refine. You will get there.
We're trying, man. And it's all good. We've tried to get that. It's just, it's fun. I mean, when this stops being fun, we're doing something else. That's the whole thing about refinement, everybody. When you get into that zone, like Dr. Avellino, he never thought he was going to be doing radio. We're talking about surgery and AR and VR on radio. What? A couple of years ago, 3 years ago, he had no idea he's going to be doing this stuff. Tony, we've got about 3 or 4 minutes to go to close this bad boy. I mean, okay, let's bounce back a little bit. We're talking about your transition, your phases of life in your 50s. We just talked about something that happened for you 3-4 years ago. You and I getting to know each other 5 years ago, 6 years ago. And then you coming into the radio program. I mean, you'd never done anything like that. Talk about it. Let's go into your phases of life. How do you like doing the radio stuff? How do you like sharing your information with your patients over radio?
Yeah, I think the most important thing that we can do is education, because I think people need to know, and people get anxiety or they get uneasy when there's uncertainty, and so the more education, the more the patient, the more the physician knows. I truly feel that the anxiety level goes down, people are more common, and you have a lot better outcomes.
Tony, do you guys utilize the virtual reality in the healing process after the fact? Do you do that? Have they done anything like that? Because I know they've done some of that with the Alzheimer's patients, and we only got a couple of minutes to go before we wrap. But I just wanted to ask you, have you done that? Have you seen that done yet?
I have not, but again, I think as the younger generation is more facile in this, but as the technology gets better, because I think the goggles now are fairly large, and I think if we can get the goggles down to eyeglasses where you can put them on and off, I think the adaptability will actually be greater.
Well, you're going to have to ask your son, because I just heard something about Meta is coming out with their Ray-Ban, their Ray-Ban artificial reality glasses, and they're gonna happen. It's coming. I mean, Tony, give me 30-second takeaway to the listeners, and we're gonna wrap.
I would say that in order to perform at your best, you have to keep on learning. You have to keep on educating yourself because, like I said in the past, you have to train your body, you have to train your craft, you have to train your mind.
That's Dr. Anthony Avellino. He is our performance living talent. This is his 14th visit on this radio program, Augmented Reality and Technology. I hope everybody can really appreciate how valuable having a friend and a guest and a co-host like a Dr. Anthony Avellino is, because I'm telling you, this guy is got $5 million hands. He does not have to do this. He is not getting paid to do this. He does this because he wants people to get better. Always remember, before you can share love with others, you must love yourself first. Thanks again to my brother from another mother, Dr. Anthony Avellino. I call him Tony. Sandy, Matt, Craig Stiles, Brock Fletcher. We'll talk to everybody next weekend. Have a great week, everybody. Go out and ignite your life. Remember, the Tom Matt Show is a production of Boomers Rock Media. We want to bring your story to life. And lastly, I want to say thank you so much to our production staff of Mitch Anderson and Vanessa. We are out.
The Tom Matt Show is produced by Mitch Anderson of Black Circle Studios. Original music from the Source of Light and Power by the Arc of All.